I'm Ben Gonzalez with the Texas Department of Insurance, and this is the Texas Insurance Podcast. On each episode, we look at an insurance topic, why it may be important to you, and offer tips to help save you some money or protect your family or property. Today, we're going to talk about health insurance, what your options are to buy a health plan, and how to shop for coverage that's going to fit your health needs. There are lots of ways to get health coverage. You may have access to a group health plan at work, or you can buy an individual health plan directly from an insurance company. And depending on your eligibility, you might be able to get coverage from a government program like Medicare or Medicaid. But no matter where you're shopping, it's good to have a plan about what you're looking for. I spoke with Misty Highnote from TDI's communications office about what you need to ask before you choose a health plan, and also what you should look out for. So Misty, if I'm a new shopper or looking for a better health plan than I currently have, where can I find and buy health insurance from?
Right, so there are four main options. The first one we'll start with is your employer. You can ask them if they offer a plan. Sometimes they might even pay for it or a portion of it. So that's a good place to start, is with your job. Another option is your spouse's plan. Maybe his or her employer offers a plan that you can get on. But if your employer and your spouse's employer both offer a plan, then look to see, compare them, do some comparisons to see if the price and the benefits are better on one or the other. You could probably choose between them. And then the third option is, if you're young, you can stay on your parents' plan until you're 26 years old. You don't have to live at home. You don't have to be enrolled in school, and you don't have to be a dependent. So that's always a good option. And then the last option is to buy your own plan. You can go to an insurance company or HealthCare.gov and research plans and buy one yourself.
So I think a lot of people think that the staying on the parents' plan, that you have to be in college or something like that, but you don't.
Right.
So there are some important dates coming up that we need to keep in mind, correct?
So right now is the open enrollment period, and that ends on January 15th. That's for HealthCare.gov. If you go to HealthCare.gov and buy a plan, that ends on January 15th. So if you want a plan that starts January 1st, that's going to be a deadline of December 15th. And then January 15th is a deadline, and that coverage will start on February 1st. So yeah, the ultimate deadline is that January 15th. But if you sign up by December 15th, your coverage will start January 1st.
Yeah, I think a lot of people do want it to start on that January 1st date. So it matches up with the plan that they might be on right now. So these are some deadlines that are coming up in this open enrollment period, but there are a few other times when you can sign up for health insurance on healthcare.gov, right?
Right. Outside the open enrollment period is called a special enrollment period. And that just means there are certain life events, certain things that come up that you might lose your health insurance, and you can get on a new plan during that special time. But there's certain events, they're pretty specific about what qualifies you to get a health plan outside of open enrollment. So some of those might be losing your health coverage. Maybe you lost your job that offered coverage and now you're without your coverage. Maybe you moved to a new state. Maybe you got married, had a baby, adopted a baby, or maybe your income just falls below a certain amount. So they want to be sure that you can still get health insurance if one of those certain life events crop up for you. And then usually you have about 60 days before or after those events. So you've probably heard, if you've had a child before, don't forget to sign up for health insurance for your child. And so you've probably heard that one. And then for things like Medicaid and CHIP, you can sign up at any time for those. And if you have a new job, you usually have about 30 days to sign up, but your employer will usually tell you how that works.
Okay, so there's lots of different ways that you can get health insurance or buy health insurance, but some of the things kind of go across all of them, and those are the things that we wanted to talk about today. Is what are some things that we need to keep in mind when we're finally going to select that plan? What are some things to know and look out for?
Right. Yeah, I'll go through a few of those. The first one is to look at the plan and make sure it's going to work for you. By that, we mean look at the benefits. So if you have a medical issue that you seek treatment, if you have a mental health issue, you want to make sure that those benefits are going to be in the plan that you're looking for, that you're going to have coverage for those specific things. And the same thing goes for your doctors and prescriptions. If you have a doctor that you really like, that you want to keep seeing, You want to make sure the plan is going to let you see that doctor. If the plan uses a network, you want to make sure that they're going to let you see that doctor as an in-network price and not an out-of-network price. And you can call the plan, you can go to your website, but you just want to ask someone, I use, Dr. Smith. Will I be able to use them on this plan? You want to be really specific. If you have a cardiologist, if you have, your specialty doctors, make sure that they're going to be in that plan as well. And then the same thing goes for your medicines. If you're taking certain medicines, you want to be sure that they're going to be covered. There's no guarantee that they are from one plan to another. And then it's a price that you can afford too. It might be covered, but it might be higher. So you want to make sure that you ask those questions. Speaking of price, you want to look at the price. Prices are very different from one plan to another. And you want to look at that out-of-pocket cost. That's a jargon word, but that basically means that that's what you're going to have to pay out of your own pocket. And the two big ones there, of course, you have your premium that you're going to have to pay for the plan itself, but then you have to have copays. Copay when you go to the doctor, deductible, that's a part of what you're going to have to pay for your plan. So you might look at a plan that has a really low premium. You think, oh, wow, that looks good. But you want to look at that copay, that deductible. If you choose a lower premium plan that has a higher copay deductible, that's, of course, fine. We just want you to be aware of it, that you might have to pay more out of pocket for that lower premium. So they're just things to look at back and forth that we just want to be sure you're aware of. And then the last thing is just to know who regulates that plan. When you get that plan, is it state? Is it a federal agency? You want to know if you have any issues with that plan, who you can go to ask questions and get help.
So that's why you need to know who the regulator is in case there's an issue down the road.
Exactly, right.
So can you just go back to the premium versus the out-of-pocket cost once again? Because I think that's important to understand is that as you get a lower premium, your out-of-pocket cost might go up and vice versa, correct?
Right, exactly. Yeah, you might see that low premium, and then you might go over and see that there's a really high deductible, and that might be hard for you to meet if you don't go to a lot of doctors, you don't see a lot of specialists. That might be hard to meet that. So it kind of depends on your health issues, your lifestyle. If you can afford that higher deductible, that higher copay at the doctor to have that lower premium. So as long as you know that exists and you can kind of, examine your life and your family to see if that's a trade-off.
Yeah. Really compare them kind of apples to apples, what you're paying out of pocket when you go to the doctor's office versus that monthly bill that you get as well.
Right.
So you mentioned costs, and that's probably going to be the number one driver for most people. So what can a person do if their budget is really, really limited?
Right. The first thing to do is check those 4 options that I told you at the top. Your employer, HealthCare.gov, your spouse's plan. I mean, maybe even compare all of those. If you're young, would it be cheaper to stay on your parents' plan? Would it be cheaper to go with your employer plan? You can also compare there too to see where you might be getting a good price. If you do go to HealthCare.gov, they do offer premium tax credits. Those are also called subsidies, if you've heard that word, and that's based on your annual income. So there's some help if you go to HealthCare.gov.
If I still need a little more help shopping, or I just need to review some of these tips that we're talking about, where can I go?
Yeah, we have a great shopping guide on our website. It goes through a lot of the checklist items that we were talking about. And there's also a lot of other things to consider when you're looking for a health plan.
So when shopping for a health plan, are there some red flags, some warning signs that consumers need to watch out for as well?
Yeah, there definitely are. There's always some bad actors there trying to take advantage of people in any situation. So yeah, we'll go over a few of those red flags, things that you can look out for. If an agent or salesperson can't answer basic questions about your plan, like how much your copay is, how much your deductible is, how much the premium is, simple things like that, that's probably a red flag that this person might be unscrupulous, might not be actually working for the company. And then never feel pressure to decide right away. I mean, you have this deadline, but if someone says you need to sign up today or there's a limited time offer by the end of this week, that's a big red flag. There's usually no limited time offers in health insurance. The price is going to be what it's going to be until the end of your open enrollment period. I mean, of course, prices will change next year, but they're not going to change overnight. So that's something to look out for. And then a price that is just much, much lower than any company you've checked with. If you look across the board and there's a premium within a certain $100 range, and you look at another plan that's just a whole lot cheaper, you might kind of wonder, what are they offering? Are there any coverages in this plan? Is this even a real plan? So that's probably, if it's too good to be true, it probably is, as you've heard before. The last one is if you get a call or an email from a company or an agent or someone who you didn't reach out to, if they just cold call you out of the blue, trying to sell you insurance, they want your personal information, your social security number, stuff like that. If you didn't call them first, don't give them any information. If you're not sure, you can always call the company. Go to Google, look for the company's official phone number and call them back. But be very careful with your personal information.
Now, is there anything that TDI can do to help people if they're not sure if this person is legitimate or if this company is actually licensed?
For sure. We have a helpline. You can call our helpline and we'll look up a company or an agent. We can tell you if they're licensed. We can tell you about their financial information. But definitely, that's a really good point. We do have every licensed company and agent's name and phone number written down. So call us to ask. Yeah, call our helpline.
As Misty said, it's very important to protect your financial information at all times. Here's a couple of additional tips. Take notes when you're shopping, especially on the phone or online. That'll help you compare plans later and remember what the differences were. Ask who you're speaking with and write down their name as well as any key features of the plans they're offering to be sure that nothing changes later. And finally, once you decide on a plan, make note of any next steps that you need to take to get the coverage started. That's it for today. We've got more information about health insurance and all kinds of insurance on our website. It's tdi.Texas.gov. You can also call TDI's helpline to ask your insurance questions or check if an agent or company is licensed. The helpline number is 800-252-3439. If you found this information useful, be sure to rate and review the Texas Insurance Podcast. And of course, subscribe and share with your friends and family. We'll talk to you next time.